I'm going to record. Oh, all right.
Okay.
Welcome everybody to another wonderful Met How at Home presentation. So grateful to Tamara Steffens and Betsy Weiss for joining us here today to talk about what it means to be a healthcare agent. So Tamara, I'll have you introduce yourself and then Betsy, and off we go. Thanks so much.
Yeah, sure. Thanks. So I am Tamara Steffen, and I am a social worker by background, and I have worked in various kind of capacities as a social worker, both inpatient at the hospital and then outpatient, running an advanced care planning program for Confluence Health. And I took a little hiatus to see what it was like to run a memory care facility. And then I ran away from that and came back to working kind of freelance. And so I work as a contracted faculty member for Honoring Choices Pacific Northwest. And then I also have the privilege of being a private geriatric care manager as well, where I get to do some of this work and touch our community as well. So that's a little bit of me. And then there's all that fun personal stuff too, but if we have time, we can chat about that.
Wonderful. Thank you so much for being here.
Yeah.
Betsy?
And my name is Betsy Weiss. I'm an internist physician by my professional background. And I've been doing advanced care planning for the Lookout Coalition locally and Meadow at Home, and have also worked with End of Life Washington. And we have enjoyed gathering people from the community together to have these discussions for a while now, over Zoom since the pandemic. And this discussion is really from the perspective of being the healthcare agent. And that voice and that perspective felt really important to us to explore. And tomorrow was suggested as a resource for us because of her active background in this area. And we're really lucky to have her join us. So she's going to take the initial discussion. Hello, Loretta.
And Loretta, since you've joined, I don't know if you've checked the chat, but there's a little link for a quiz. If you have the opportunity to click on that and take that little quiz, we'll maybe dialogue a little bit about that later. The link doesn't work. Oh.
Yeah, I think you might copy it and paste it in your browser and it might work. If that.
Yeah, I think you'll have to do that.
I'm not sure I can copy it. Anyway.
Well, yeah, hopefully that will work. Won't copy in an active window. And if you hit Control, does it work? Yeah, try and hit Control and then click on the link.
Yeah, or we can copy it from the chat. Yes, that'll work.
Okay. Well, so I'm just going to kind of lead us through a few PowerPoints, not to dominate the conversation by any means, but to stimulate it. So as we go through, since we're a nice, tidy group, let's just feel free to chat about what strikes us and what's important and what questions we have. So the first thing I kind of thought would be helpful is if we get a little bit of an idea of what you're hoping for from our time together here, and then telling us any experience that you've had operating or acting as a healthcare agent or a proxy.
Have I, your question was?
Tell us.
I'm doing the quiz.
No problem. So that hopefully the questions are up on the screen too, but yeah. What you're hoping for from our time together today, kind of what brought you here, what made you go ahead and be here, and then any experience that you might have had acting as a healthcare agent or proxy.
Frauke, you want to start?
Sure, I'll start. I actually haven't had any experience as a healthcare agent other than informally for my mother when she was dying, um, and um, or the what was the other one, or a proxy. I'm real. What drew me to this conversation is in thinking about my own healthcare uh, directives, about uh, whether to use um, a family member to be that uh, agent, or and as I got to thinking about it and having a discussion with my husband, that for me, I think I would prefer to have somebody who's not a family member, because even though my directives may be very clear, they may not be able to fulfill them when they're in the situation.
I
And
love your thinking.
and then how, but then I started thinking about, who do I ask? I could ask Betsy. I could ask other people who know me. But how does one go about it? And are there perhaps healthcare agents that are, that we can hire, that we can compensate for that role? And if that's a common practice, rather than just, even if it's a friend, to give that person some compensation when they've finished with it.
Yeah.
That's
Well, perfect, because we're definitely going to kind of really noodle on how to choose the right person and what you're hoping for in that person and how to communicate with that person. And then as far as hiring for, in Washington State, we don't have an actual like company that I know of. I'll send out a link to Tracy about a kind of nationwide organization that does do some for hire healthcare agent info. I just don't have that quick and handy, but that's a potential option.
Those are terrific places to start, Frauke, so thank you.
Yeah.
Loretta, do you want to jump in?
Hi there, everybody. I'm Loretta Bell, and I'm here to sort of lurk and learn as a potential volunteer with the ACP group. So that's what I'm hoping to get from our time together today. The experience I've had as a healthcare agent was for my mother, who was a medically fragile person at the latter part of her life, and became demented. My professional experiences as an RN in critical care, and the couple of hospitals I worked with, we had a really strong nursing advocate program of engaging people at certain points about these issues. So yeah, I think that's about it. Thank you. I'm a little like, I'm sorry, I'm a little having cognitive dissonance. I can see Betsy. Does anybody see me? Like,
Yes, I see you.
Oh, okay.
Can you check your view on your computer? And
Sorry.
if you do the gallery, side-by-side gallery, you'll get everybody.
I did look at the view, and it didn't give me those options this time. That's okay. It's okay. It's no big deal. But oh, go ahead.
Tamara is screen sharing, so there aren't as many squares to be seen right now. And so
I see you now, Tracy.
And we also
okay. Sorry.
We also had Antonia join, so
okay.
I cannot see you, Antonia, but are you here?
Oh,
can you hear?
I can hear you.
Great.
So if there's also there might be a little
Tanya.
Oh, hi, Tanya. just real quick, I wanted to add, there might be a little arrow or a caret at the top or the bottom of the images that you see of people. And if you click on that, it might give you a better view, take you off, and allow you to see more of the people.
Ah, there we go.
No, I don't have that. How weird. Oh,
Uh,
there's the side-by-side gallery. Maybe that'll do it. Okay, that helped. Okay, thank you. That side, but I was looking at another view option next to viewing Tamara's screen. Sorry for the distraction. I appreciate it. Now that I'm a little more oriented, thank you.
That's great.
It's just weird.
And then Tanya, I don't know if you're able to click on the chat. There is a link for a small quiz at some point if you wanted to try and cut and paste that into your browser if you're able to, and take that little quiz. It's kind of interesting.
okay.
But if that's,
I'm not sure.
I know, and sometimes that
I
becomes
see
a
a
little
little
tricky.
screen, but it doesn't. I'm not sure how to.
I might have you leave that for a minute and just ask you the two questions that Tamara has given us. What are your hopes? What you hope to get from our time together, and if you have had experience as a healthcare agent, how has that been?
You know, maybe I'm not a healthcare person, so maybe I shouldn't be on this. So no, I have no experience.
Okay, that's absolutely fine.
Okay.
That's the people we want to have come to this.
That's right. Every living, breathing person, that's what we want to have connected for this. So I'm going to just take us forward to this to kind of give you just a quick overview. This image helps us see where some of these conversations and some of these documents and things fall into. So advanced care planning is kind of that global look at things. An advanced directive is a specific document that usually sounds similar to a living will. You might hear something about a living will, and the advanced directive usually has conditions, and it's really tightly wrapped around closer to end of life situations where somebody is in a persistent vegetative state is sometimes what the language is. So that's kind of where an advanced directive, it's a targeted discussion and a targeted form. And then the other one that you see, that DPOHC is encompassed in that. And that's really what we're kind of talking about mostly today. And that's that durable power of attorney for healthcare. And that's kind of our focus. And then the healthcare directive is that living will document. And then the POST is really a specific document, and you guys probably have opportunities to talk about that separately. But the POST is really targeted for folks who are dealing with closer to end of life or chronic severe illnesses. Betsy, anything you want to add? You just chime in as we go.
Okay.
So I love, Tanya, that you said didn't know if you were to be here. So here's the top qualifier: everybody over the age of 18. So I'm not going to take big guesses, but I think we all qualify. And this is really what advanced care planning is about. It's that talking about it. It's helping to facilitate conversations with important people in your life, and specifically about somebody that is going to be named as your healthcare agent or your proxy. And then taking the time to write down what's important to you, and then making sure it's properly communicated. But we're really going to mostly focus on that, like Betsy had said, the role of the healthcare agent. So just thinking about what makes a good healthcare agent. And sometimes you hear there's a lot of interchangeable terms for that. I tend to use the term agent or healthcare agent. Proxy is not uncommon. Surrogate is a very common term they use in Canada. So those are some of the terms you might hear for it. So in just thinking of the qualities of a good healthcare agent, first of all, they have to agree to the role. And sometimes that seems very simple, but they don't have to formally agree to that in writing. So you could name a healthcare agent and be done, and they could never know they were named. And literally, written on a legal document that you completed, they may never know that. And I've had more than one unfortunate opportunity as a social worker in the intensive care unit, calling someone and saying, hi, so you're the healthcare agent for John Doe. I just need to talk with you a little bit about some circumstances here. And now they have to make medical decisions, and they never agreed to that role. So it's really critical that that first step happens. The other is to talk about your goals and your values and your preferences. And there's a few different tools out there to help you kind of explore that. Some of the formal advanced directives and websites that are out there, and I'll share some of those links with you in a little bit, help you really talk about your goals and your values and your preferences. I think the two most important things in my mind related to that is how do you want to live, and what things are kind of the bottom line non-negotiables for you. What brings you joy, and what would you not want to have to give up when there were serious decisions that had to make on your behalf. And that exploring those things are really important for you. And having somebody that can have that kind of dialogue is really important. And that can be on that really global level. And once you've been able to do that, you can kind of hone that in a little bit more specifically and talk about different outcomes in medical emergencies that would be acceptable and not acceptable for you.
You might just give a couple of examples, like if you were someone for whom living independently was the most important thing to you, then that might drive certain kinds of decisions about your care if you were seriously or critically ill. If you were someone who really, the thing that was most important to them was just to be able to sit by a window and feel the sun on your face, and you thought you could be content without necessarily knowing much about what was going on around you, but just experiencing the birds and the sun was enough, that might influence decision-making differently than if your goals were to live independently.
Yeah,
Obviously,
I love that.
there are a whole range of things in between there.
Yeah, right. I like to share that, for me, a good day has a lot to do with still raising my children. They're teenagers, and I believe they need me deeply. They need everything that can come out of my brain and into theirs. And so for me right now, I am, if my healthcare agent had to make a decision about my mental capacity versus my physical capacity, I'm okay with negotiating on some things physically so that I can cognitively engage with my children. That may change in the future, but right now that's kind of where I'm at, and I would revisit that hopefully in the future. Your healthcare agent that you choose should be able to follow your decisions, even if they don't agree. And this is a really important one because a lot of people automatically think your significant other or your partner in life would be the right person. I'm going to choose my spouse or my significant other. Can that person honor your decisions? Or is it going to be too hard for them to say, no, she said she didn't want to proceed with any other things, and she didn't want, extreme measures. She didn't want intubation. Can they sit comfortably with that? Are they able to advocate for what you want and not for what they would want? And so really weighing that out is an important step to take.
I think this raises, or Frauke kind of raised this issue in thinking about who she might choose as a healthcare agent, and would making decisions consistent with her beliefs, might that be a difficult thing for a family member? And does she want to spare them that? One of the things that's true, though, is that you can't know without talking to them about how they would feel about making decisions for you. And the other part of that is that it's really important, even if somebody close to you isn't the person you choose as your decision maker, that they know what you want, because you want your decision maker to be able to follow your wishes, but it really reduces the burden on the decision maker if the other important people in your life are aware of your wishes.
Yeah. I think the other part of this is that choosing a second person really helps with this, as well as kind of the next step. So being able to follow your decisions, even if they don't agree with it, and also making decisions in difficult times. So somebody who can really sit with the pressure that comes with some of these decisions and still advocate for what your wishes are. I think of just being able to stand up to the white coats at the bedside and say, stop, we talked about this. This is not what she would have wanted. Is your chosen person going to be able to do that? And is there a second person behind that could be there with them if they get to that point? All along we're ready to do that, but didn't realize how tough that really is. And somebody that they can freely dialogue with, so that you've got a conversation between the three of you about how you want to live and what kind of things are important and non-negotiable for you. Any thoughts or questions or ideas on those characteristics?
I think that's a really great point, you know, because it is such a big responsibility for one person, that to really try to think about who would be a good team in a case like that. Because, you know, if something is happening in an emergency, it's really difficult to keep your head on, and it's very helpful to have a team approach at that moment, I'd say. So
Yeah.
I think that's a really good point.
And another good reason is that a lot of times you might be very close to that person that you've chosen as your healthcare agent, even in just day-to-day living. So you go for a drive over the pass and you both get in a car accident and you're both temporarily unable to make decisions. And it might not be end of life decisions. It could be post-operative decisions. So you've been in a situation where you've had anesthesia and you're having a tough time coming out of that, and you're a little foggy and confused and not able to make decisions. That healthcare agent would be enacted to help make decisions for you during that time. And it could be something like, well, should we proceed with this next level of surgery, or do we add this, you know, next procedure with them? So another reason to have a second agent that is involved.
I think that I'll just expand on that a little bit too, because I think that it's such an important moment. When we're making decisions for someone else in emotionally charged and kind of environments, and where people aren't their clearest and most settled selves, it's hard to even get the information you need to make a decision. And that's one of the roles of the decision maker, is to push the healthcare team to give them the kinds of information that they need to be in a position to make this decision. So that means asking questions like, what do you expect the outcome of this illness to be? And what do you expect their life to be? And so they will say, well, we can't say exactly. And you have to push them and you say, well, is there a 50% chance that they're going to be able to live independently, or a 25% chance? Is there a 10% chance that they're going to be able to make decisions on their own in the future, or a 60% chance? And they'll resist giving you that kind of information, but they often have more information than they share easily. It's, you know, I think that what they hate to do is foreclose hope.
Mm-hmm.
And yet at the same time, when you're trying to make a decision for somebody, you have to have a realistic expectation of what an outcome might be. And it's a hard job, or it can be.
Do you think it's beneficial to try to find a healthcare agent who does have some experience in the medical field at all? Because just in terms of levels of comfort and knowing, some of the vocabulary and having the confidence to ask questions in those moments.
Betsy, I'm sure you'll have some input on that. My opinion would be what's most important is that they know you and they can speak up for you, because that information can be gathered. And you want somebody who can process information that's given to them, and they can find that, but really representing you is the most important thing.
I agree with that. I think lots of times you're not being asked what kind of antibiotic to give, or what the information that you're after is really about the effectiveness of this treatment and what you expect from the treatment. So you need somebody who's able. I think you're right, Tracy, that oftentimes people who have had some familiarity with a healthcare environment, either they've been a healthcare agent for someone else, or they've been ill themselves, or they've experienced illness in a family member. They can move into those situations with a different ease than somebody who's never, for whom it's a totally alien environment and the vocabulary is bizarre and unfamiliar. So I think sometimes that's that having had some kind of experience with illness or healthcare is helpful, but I don't think it's the most important thing. I think the most important thing is that, one, you have had great discussions with these people and have a heart connection to them, in the sense that you trust them, and that they know what they are strong in a situation that's stressful.
Well, this next section really kind of speaks to that quiz, if you were able to take it. This is about, in Washington state and many states, there is a legal hierarchy, or kind of a mandated who's next on the list if a healthcare agent isn't chosen. So if you're able to see this, it talks about so if there's a guardian in place, you're going to know it, or you won't know it, but somebody will know it for sure. The guardian is a very formal legal procedure. Then next on the hierarchy is that designated healthcare agent, somebody with whom you've had that conversation and about whom you have documentation. And then next becomes your registered domestic partner or your spouse. And then your adult children, your parents, adult siblings, grandchildren. As you go down that list, you'll see the little asterisk. What that asterisk means is that anybody in that group, your adult children, so right now, technically, I have 3 adult children. They would all have to agree, had I not already done my healthcare agent work, on what I would want. And I can't get them to agree who's bringing what for Thanksgiving. So I can't imagine that they're going to be very comfortable doing that. So I'm glad that, I've done some forework. I need to keep visiting that. And if you don't have adult children and your parents are still living, they may be the ones that have to make that decision for you, and so on down. So it can be a pretty great challenge. I know when I took the quiz, there's 14 people for whom I might automatically be called to make decisions. And, as much as I can interface with the people in my life, I try to have this kind of conversation. And I highly encourage you to think about doing the same. Anybody else want to share their results and kind of your thought on this automatic hierarchy in Washington state?
I just think it brings back the importance of, yeah, we all might be a healthcare agent at any moment. And so, as you say, just the importance of having conversations with people and having.
Sorry.
Yeah, no, that's I'm good.
I'm, long away from the bedside, but I can tell you that I've been involved in more than one situation, unfortunately, because of the areas I worked in, where these are unexpected situations and people do not have this in place. And then the sequela of what happens when this is not in place is damaging to survivors, and it delays everything. And I think you mentioned that here. And the other thing I'd say, and I think people like Betsy and myself really, really want to know what you want. We don't, and we don't go to work wanting to make these decisions for people.
Mm.
Really, I don't like to speak for other people, but that's not why I showed up at the bedside. I wanted those decisions. It was so much more peaceful and clear when people could do a bit of that. And to second Betsy, it's still muddy, but I would just add that I've been in too many situations where these things are not in place, and it's actually a kind of tragedy, even if people are surviving whatever put them in the hospital.
Yeah, you're absolutely right. I think one of the things I know to be true also is that what it does, if these decisions or these discussions don't happen in advance in a peaceful, non-threatening environment, the person that is surviving is now not able to just grieve, which is such an important thing to take the time to be present, to really know I'm grieving the loss of a person. I'm not grieving the decisions I had to make, because that just muddles up the grief in that relationship. So if you at least know, you know what, no, we talked about it. I mean, it's still tough. It's always tough, but at least you talked about it. And you know that you operated in their best interest based on that communication. And now you're able to love the loss and not, fear the decisions.
And I just want to add one more thing. I've been, unfortunately, witness to situations where family will be assembled. There will not have been these discussions. And then there's conflict happening at the bedside. And it's, it didn't have to happen that way.
Yeah,
and
absolutely.
Time.
Yeah, you're right.
So, yeah, I mean, and so if you're the person who is deciding who in your family or not family to become the agent, back to knowing your players best. If there are people who will not handle this role, who are too in conflict in your own family, then you know who to not place as your number two, because they will not be in agreement. Because once you can't speak for yourself, I've seen this happen too. So they think they have a healthcare agent, and then the number two or three come along and say, oh no, then there's conflict again. Have you seen?
Yeah, absolutely. Yeah. And then you're dealing with the conflict within people and not the need that needs to be discussed.
Yeah.
Yeah. Well, those are great points. I think, sorry, I didn't do my animations correct on this, so you'll have to ignore that little guy staring at you there. Just the idea of, it's an honor to serve in this role, but it can be a great challenge. And so I'd love to hear some of your ideas and your thoughts on what you feel you might need to be able to do a good job for someone else.
Great question.
Well, just going back, I do think that having a kind of a three-way discussion, and so not everything would be falling onto my shoulders, but could be collaborated upon, I think would help me to just feel more solid in a role like that.
Yeah. So having an in advanced interactive communication opportunities would be good.
Yeah, with the whole team, so that the number 1 and 2 healthcare agents were both there at once and in the same conversation, and
Yeah,
I think that would be helpful.
that's good. Yeah. Anyone else?
Would it be helpful when you have that conversation with your healthcare agents to have your family there as well, whether it be live or Zoom or my kids, we were all together recently and they, they just don't want to have that discussion yet. I said, hey, you guys, how quick, we just lost somebody in our family and it just happened so quickly. And I said, you all know how quickly it can happen and we have to talk about it. And we're old, we're not busy,
Frank,
age-wise,
I know how precious you are to your children and the world as a whole. So I know how hard it must be for them to even imagine the world without you. But I think you're so right that it is really important for them to have that conversation with you. And we have a movie, Meadow at Home has this movie, Speaking of Dying, that often is a very gentle way to engage family in discussion. I mean, I've heard this so often that cherished parents, I mean, the idea of imagining them gone is just untenable. And but it is such a gift to have that conversation to you. And if you can let them know that this isn't about them, it's about your comfort and assurance that this is a gift to you, they might be able to hear it better. And we have several copies of Speaking of Dying and are happy to loan it out. I think the best way to watch it is with them physically present, but you could, it's actually on Vimeo or one of those streaming services. So you could watch it together and then discuss it afterwards, since they're all over the map.
That's great. Yeah. Honoring Choices has a couple of resources too. There's something called a foolproof game sheet, and I'll send those to Tracy and she can send them out to all of you. We also have a reflection guide, which kind of just gives you, thinking about what your values and preferences are. And then in a couple minutes, I'll share with you a couple of websites too that you can do. And the other thing to do is really think about over your life so far, what kind of healthcare related decisions have you had to make? And they could be minute ones, like, should I start this medication or not? Or should I increase the dose of the medication? Do I treat pain or am I somebody who kind of pushes it because I don't like to be drowsy or fuzzy headed? Have you ever had a procedure and how did you weigh out when you made the decision to go forward with the surgery? Did you postpone it for a while till you gathered more information? And then even the idea of switching a medical provider, or have you ever done that? And, talking with your loved ones about those kind of things that you've done already helps them understand how you thought about your healthcare. If you got rid of a doctor in the past, why was it? Was it because you just thought they were, they just kept shooting off everything they thought needed to happen and were aggressive? Or maybe the opposite, that they did seem confident and you wanted somebody who was confident in their decisions. So, talking about how you've made decisions so far with your healthcare is a great way to have that dialogue with people too. Sorry, I was clicking on this to share a few more things on accident there. I think the other thing to really think about is what will be the biggest challenge for you if you're named as a healthcare agent, and or if you're having that dialogue with your healthcare agent. If you were to reverse it, to put it in the opposite, what would be the biggest challenge? And make sure you kind of address that in that, as you say, pass the turkey pass the turkey, and I want to talk about there is, speaking of passing the turkey, there is something called Death Over Dinner, which does give you some dialogue as well about, how to interact with folks. There's also a game called the Death Deck, which you can, it just has some cards, just some thought-provoking. It's really not just all about, anything that seems dark and morbid. It really is more kind of value-based, really bringing out what's important in living and decision-making for you.
I have a death deck, and I'm happy to share it. So it's another, you can get it online, but if you want to just take a look at it and play with it, it's, I have one.
Okay. I just need to ask, is my screen paused? Let's see.
I think so. It's on, okay. It can be an honor to serve in this role.
Okay. And that's probably in the way. Oh, golly. Oh, I just lost it.
Oh, there we all are.
And you don't get to see that final thing. So sorry, hold on one second.
Does the death deck make you laugh?
If there's some serious questions in it, I'll pull out a couple there. But it's a full range of things. It's some of them are funny, and some of them are not. If you had to choose one of these classic gruesome movie deaths, which would it be? Hitchcock's Psycho style of shower by knife stabbing, Jaws style, chewed up by a badass great white shark, Raiders of the Lost Ark style, face melted off by a holy ghost. None of those sound particularly appealing to me, I can tell you. What scares you most about dying? Fear of the unknown, the pain of the process, it happening too soon. So it's a full range of things.
Yeah. Thank you.
I took him camping one time. I think David was a little flipped out by her.
I'll let it go now.
That's great. The other thing I think it'd be fun to dialogue, not fun, but important to dialogue about is, when is it appropriate to decline? If you've been asked to be a healthcare agent, when do you think it's appropriate for you to say, I just don't think this is the right thing for me?
Maybe
I find that a really difficult question for being a parent. As a parent, being your child's proxy. It's unless, I mean, again, it's really important to have those conversations, but I get all kinds of feelings in the way of limiting care, certainly. So
For sure. Tracy, did you have something you were going to share?
Well, I just think it is important, even though it is such an honor, like if you're in a place in your life where you're kind of like at a deficit in your own self, it might not be the best time to take on that responsibility.
Yeah, you're right. Yeah, if you're feeling fragile in any way, I think it's very appropriate to honor yourself as well as them, and even bring it up, say that, I've had some major events happen in my life. I know you've asked me to be your healthcare agent. I kind of want to revisit that with you right now. And let's talk about who your second person was, because I think maybe we need to move them to the top.
Mm-hmm. A lot of people experience trauma in the medical system too. I've seen that over and over. And so, yeah, and like you say, that can shift and change. And so if you are someone's designated person, and then in the meantime, you have kind of a traumatic reaction, then you might not be able to make the best decisions.
That's true. That's true. I think one of the kind of related to that trauma, but maybe not in the midst of it, after it, one of the questions I love to have people try and explore is, what did you learn from that experience? Not really how did you feel, what was it like for you, but what did you learn? Because it really does help people sit in their brain for a few minutes and kind of process it. And it could be, you know, I learned that my brother really was comfortable telling those doctors to knock it off. Or I learned that it was okay, you know, I mean, it could have even learned that it was okay for them to be intubated. And I was comfortable with that. You know, there could be a complete shift in the way you saw things. So what you learned from any medical issues that you were witness to, or you know, experienced personally, or hospitalizations that you were either personally a part of, or, you know, Loretta, that you worked in. What did you learn from that experience that applies to your own, you know, healthcare agent status? All of those things, you know, it's important to explore. Well, here's just a couple of links and resources. You obviously are connected to Methow at Home. And then Honoring Choices. Please feel free to explore our website as well. We have lots of resources. We also have partners within the community and also nationwide. So if you're working with people and family members in other areas, Honoring Choices has many similar coalitions in other states that may have resources for you. Prepare for Your Care is a great website. What I like about it is it has a lot of short videos that kind of explore different scenarios. And so for people who really don't want to sit there and read, or don't even want to be sitting there having just a big dialogue conversation, maybe they don't want to play the game, the videos that are in Prepare for Your Care is a nice way to kind of connect with people. And then the Conversation Project is lots and lots of tools, a pretty huge organization that does lots of things to connect people with meaningful conversations and materials to access those.
I might also mention End of Life Washington. I think they've got some really great resources on their website. We think of it as a place to go to learn about Washington's Death with Dignity law, but it has a lot more than that there. And the primary philosophy of that organization is not to push any choice, but to help you be aware of your choices and help give you tools to advocate for whatever choices you might want to make around healthcare. So it's to sort of help you be your own advocate as you have discussions about your choices in healthcare.
Good. Yeah, thank you. I will share the PowerPoint and a couple of the links that we discussed here as well. In addition to at Honoring Choices, if you want a similar conversation, every month we do a public webinar, and it rotates the topic. So every month, myself or Charmin Figashaw, who's been smart enough to move into your community, and a couple of others, we rotate either talking about, we do one that's called an introduction to advanced care planning. So it's really a global look at what it is. And then the other is actually diving into completing your advanced directive itself. And so the link for that's on our website, and you're always welcome to join one of those or send the same idea to other people too. We also have something that's nice, and that is a postcard. So you can go in our resources and click out this postcard and then personalize it. And it basically says, hey, I want to chat with you about something important. And then kind of getting that on your important people in your life on their agenda.
And Frauke and Tanya, I will be in touch with both of you after this at some point in the next week or so, just to make sure you don't have other questions. And if you want to move forward with some support in completing some of the paperwork, we can do it in person now.
Fabulous. That's great.
One thing that I want to just kind of make a little pitch for as well is that I think it's so important to be clear about our healthcare desires, but also I think it's really important to think about death care and after we die, what is important to us, because there's a lot of decisions that need to get made right there. And, you know, some people have a specific tradition, but so many of us don't. And so it's really, I think it just can be a very empowering time for the family, or it can be a very disempowering time. And so that's a piece that I think doesn't get spoken about as much in the end of life. And it can really affect the way the grieving goes for our family. So I just
Yeah.
put pitch in there.
No, I love that. I just recently watched a film. I think it was on Netflix. It's called Alternate Endings. And I don't know if you've seen that, but a lot of the options that are kind of shared on there, we don't necessarily have. But what it did for me is it really got me thinking more creatively about what's important to me and what I might want. And it just kind of opened the idea of thinking, wait a minute, there's so much in our culture that we just say it goes like this, and then you do that, and next this. And even like my daughter's wedding in the future, this looking at alternate endings made me think, wait a minute, you have to do it in this canned way. There's a lot of options. So, you know, thinking through that, I think it's good.
And we're fortunate in this community. Tamara, I guess, is exploring or about to begin or has begun a death doula program. And we're fortunate in this community to have some death doulas who I hope will share with Meadow at Home some of their strategies and discussions about navigating this part of life too. And so.
Sounds like you got another webinar content coming up pretty good.
Yeah.
Yeah, great. Well, thank you for letting me be a part of this discussion. I love what your community does, and I think it's fabulous, and it's been great to connect with all of you.
Fantastic. If everyone could just stay on for just 1 second while I